Thank you so much for having me to do this presentation. My name is Dr. Elizabeth Ziemann. I practice family medicine at Aurora on 22nd Avenue in Kenosha. And I'm just going to give you a little background on myself first. So I went to college, med school, and residency at the University of Iowa in Iowa City, and then practiced in San Francisco for 3 years, and then was in the northwest suburbs of Chicago, now in Kenosha. And part of my work here at Aurora is being a member of the LGBTQ steering committee, which has been wonderful. And in terms of my practice, I see patients of all ages, genders, gender expressions, and sexual orientation. I do prescribe hormones for trans and non-binary folks and refer to specialists for other services like surgery. I also speak Spanish, and in terms of our spectrum of services, I do STI screening, contraception counseling, and prescribing contraception, pap smears, and preventive care, which is talking about diet and exercise and weight and making sure people have their vaccines and anything that can help prevent problems down the road. And then I also manage chronic conditions like diabetes, high blood pressure, high cholesterol, pretty much anything you could think of. And what I left off of here actually is acute concern. So people have back pain or they hurt themselves or anything that just comes up, that's what we're there for. So it's really a very wide spectrum and I really enjoy that aspect. So let's focus in a little bit more on the LGBTQIA population. There are definitely well-documented and well-researched disparities in that population, including increased suicide risk for youth, increased homelessness for youth. Lesbians are less likely to get preventive services for cancer, including breast and cervical cancer. Gay men are at higher risk of HIV and other STDs, especially in communities of color. Lesbian and bisexual females are more likely to be overweight or obese. Transgender folks have a higher prevalence of HIV, STDs, victimization, mental health issues, and suicide, and are less likely to have health insurance. And elderly LGBTQ folks face additional barriers to health because of isolation and lack of social services and culturally competent providers. LGBTQ populations also have the highest rates of tobacco, alcohol, and other drug use. And this comes from the healthypeople.gov website, which I found very interesting. So I know that sounds all very doom and gloom, but really the point is there are real concerns that aren't being addressed, and there are things we can do as a healthcare system to try to close those gaps. So in terms of medical education, in the United States and Canada, 67.3% of medical students rated their LGBT related curriculum as poor or very poor. And even though clinicians may self-report that they're familiar with issues, there's clearly still gaps in practice and knowledge that we need more training, especially in transgender health and how we talk to patients about sexual orientation and gender identity. And that is not just the providers, it's also the staff and everyone who, from the minute the patient walks in to the front desk, to the medical assistant, the nurse, the physician, or the what we call APP, advanced practice provider, which are physician assistants, nurse practitioners, et cetera, that everyone be working as a team and be on the same page and be respectful and use correct terminology. So how do we find someone who we think might be LGBTQI friendly? So word of mouth is always the number one. That's how most of my patients end up coming to me, is I'll meet someone and then they tell their friends and then they tell their friends or family, and it ends up spiraling from there, which is great. We love that. And then events. So talks like we're doing right now. We usually have a booth at Kenosha Pride. I just emailed about that earlier today, and we should be there again this year. There's just been some, funkiness because of COVID, of course. And then also online. So Aurora has a webpage dedicated to LGBTQ health. I'm sure most places do. And I'm sorry if you can hear my kids in the background. And the glma.org, which was previously called the Gay and Lesbian Medical Association, also has a directory, which in doing this presentation, I actually created a profile there, which I didn't know it existed. So that's why I like doing these things. I always learn something myself. And there's also Wisconsin Transgender Health Coalition that has a directory, and that website is listed there as well. I personally created a profile. I think they're just kind of picking up steam. And there's lots of stuff online. So like with all things online, you kind of take it with a grain of salt. And I just like to emphasize to people, just because you go see a doctor doesn't, or other health professional, it doesn't mean you have to keep seeing them. If it's not a good match, it's not a good match. I would also say sometimes it takes more than one visit to build that rapport and that relationship. But obviously, if you're not comfortable, don't go back. And then in terms of evaluating the provider, look at their online profile. We almost all have them now. Ours at Aurora mostly have videos as well. Look for an interest in LGBTQIA healthcare. Look for inclusive language. You can read patient reviews. Ours are all online. And call the office and do a little bit of research. Ask if the provider sees a lot of LGBTQIA patients, and ask if they have an interest in that. And then during the intake process, which is like filling out all the forms, doing any registration online, talking to the receptionist, see if they ask about legal versus preferred name. What are your pronouns? Basically, taking an appropriate demographic history is important. And then when you do arrive, keep in mind that hopefully the staff will be well educated and use correct language, but sometimes the provider has a little more experience. So, I mean, in my experience, our LGBTQIA patients are very understanding and really cut us a lot of slack, which I appreciate, but just things to keep in mind. And when you're in the office, you can look for signage, photographs, brochures that include something other than just heterosexual white people. That can be a good sign, but just remember that some organizations have strict rules about that, so you may not see that. I actually have a little rainbow heart on my badge, and I have some pins that I wore on my coat when I was wearing a white coat, which I don't do anymore, but just little stuff like that can kind of be reassuring. And then, again, try to be patient with us the first visit because we're just getting to know you, and we need to sort of get to know how you like to be addressed and, what makes you comfortable. And then again, giving us as much information as you feel comfortable disclosing is very helpful. And if you need to correct us, please do. I mean, we're human and we're here to learn as well. And then trust your instincts. So if you just don't have a good feeling about it, you can finish the visit and go on your merry way. And we hope you come back. But if you don't, we understand. But for the most part, I would say our patients. I don't know if that static is coming across for everybody. I can hear it, but hopefully it's not. So I wanted to share. At first identifying as.
Okay, Dr. Ziemann, you've cut out. Everyone else is still muted, so we're not getting any. Yeah, we're all saying we can hear the static on our end, but all the other attendees are muted, so it's not coming from another microphone. But now,
strange. Okay,
there now you're back. Okay,
yeah, it seems to have gone away. Okay, sorry. Hopefully that won't happen again. So I just wanted to share kind of a clinical vignette as an example of things that happen in our clinical practice. So I had a patient establish with me in February of 2019, and the first few visits identified as female. And in April disclosed that he was trans and wanted to start testosterone. I had never prescribed hormones before, and it had an interest in it. And it really just took a patient asking me, are you willing to do this? And I said, as long as you're a patient with me, I'm happy to try to learn. So he was willing, and we did informed consent, and that's another important thing to look for. Is there's actually some very thorough consent forms for starting hormones, and we don't want to make it an overly difficult process. We just want to make sure we're giving all the information that people would want or need. And so we did that and started testosterone. The patient went on to have breast reduction surgery. The only reason he didn't have a full mastectomy was because of insurance coverage. And we continue to do the preventive screenings needed, like pap smears, which we did. And now he's engaged. He's doing very well. And I would say, it's been a really great experience for me. I feel very privileged to be able to help people in that way. And it's been a really great part of my practice. So I know that's kind of a whirlwind of info. That's my information. I know that was only like 14 or 15 minutes, but I didn't want to drag it out for no reason either. So if people have questions, I'm happy to answer them. I'm also happy to provide my email address if people don't want to ask questions now, and we can get that to you.